Good afternoon. My name is Lamarck Palvido, founder and CEO of CareStarter, and we're taking care of business. You might wonder what kind of business, and that is building patient-first technology. 8.5 years ago, I walked into a pediatrician's office with my oldest daughter, and we were diagnosed with autism. And I say we were diagnosed, I mean, it hits the whole family. My daughter, me, my wife, our children. It's a family issue. And this is what we were given, a sheet of paper with autism at the top and a lot of grim statistics at the bottom, and the doc walks out of the room without one referral. Whew, that was a heavy, heavy load. You know what? It took us a year of searching the internet late at night, trying to figure out what autism was, what resources we needed to access, and what providers were out there that could actually help Ashlyn improve, to develop, to be all that she can be. And I think that's too long. And so I'm happy to announce today and talk to you today about our app, CareStarter. We are helping patients at the most critical point of need, at diagnosis. We're revolutionizing continuity of care, and we're doing that with this platform. Our platform is patient-centric. We focus on patients. What's their needs? What is their diagnosis? And from that diagnosis or set of diagnoses, we facilitate information. We facilitate articles. We help them find providers. Our provider resource engine, I'm happy to say, is alive and doing well, and it launched on the app stores this morning in iTunes and Google Play. It's called the Connections app. It's a partnership with a nonprofit that I founded that's building the special care industry. We know this space. And more importantly, we believe that patients should be in the driver's seat, and this app puts them right there. So how do we make money? This platform spins out 4 distinct buckets of revenue. And I'd love to talk to you more after the presentation about how that works, where we are in development today, and where we're going. But I can tell you right now, we have featured providers. One of the most important things as a startup is to realize that you're a startup. And if you can't sell what you're developing currently, if you can't get people excited about it, if you can't get paying customers on board, then quite frankly, you're spinning your wheels. And so we began to onboard customers less than 60 days ago. We started our sales cycle talking to customers and saying, look, we believe in patient care. We believe in helping patients make the choice. And by the way, if we have 100 patients in a room, if all of you, 350 patients, if you all have the same diagnosis and we are all in the same disease life cycle, let me ask you a question. Would we agree on one path of care? The answer to that question is absolutely not. In fact, we know that patients need to find their own path of care. And they can't do that without options, and our platform brings that to them. And it just so happens that we can make a lot of money helping people and doing the right thing. We have customers in the room, and I can encourage you, listen, I don't lack passion, but if you want to know why this is working, I don't think you should just talk to me, talk to my customers. A lot of these folks up here, we have over 50 signed contracts. These folks are on the screen because they're in the room today. I want you to talk to them about patient care. Why is it that they believe that this needs to be changed, and why would they pay CareStarter, a startup, money to engage patients in their own condition? I think this is very important, and we're excited about it. But everybody in this room, everyone is thinking about acute diagnosis and referral right now. This is interesting to me because when you're diagnosed with a condition, there's nothing acute about it. In fact, chronic illness is over half of Americans, and I've got news for you. This right here is a $1.4 billion opportunity. This is healthcare today, but I don't believe in this, I believe in this. This is our vision of healthcare. Less than 25% of the resources a patient needs are medical in nature at the point of diagnosis. The other 75% of resources are the resources that are so hard to find and families need so desperately. And by the way, when they access those resources, they have better outcomes, and our platform gets this. We facilitate it quickly, and we believe in this process. This is a $100 billion opportunity for us. Half of Americans have chronic disease, but our beachhead is going to be pediatrics. And our beachhead is pediatrics. We know this space, but we chose this space for several reasons. Number one, we're alone in this space. We're highly unique. We're an outside-in strategy to health systems. We partner with doctors, providers, and other therapy companies to get our technology in the hands of patients. Another reason that we're in that space is because the lifetime value of a pediatric customer is exponentially greater than an adult. Why? Because the need of resources is 18 to 30 years. Not 6 months. They don't just need a doctor referral. They need many resources over a period of time. This leads us to our big announcement of today, and that is that we just signed a letter of intent with Baylor Scott & White Health Systems, specifically Scott & White Healthcare, McLean's Children's in Temple, Texas. We wanted to get McLean's, this amazing system. We wanted to partner with McLean's for one special reason. They're a regional system, and we want to flex our muscle. We want to show you guys and patients and healthcare what our platform can do. We want to cover a regional territory, facilitating care across many different counties and several hundred miles. This shows the power of what we're doing. So how does this roll out? McLean Children's, when I first met with them, I'm thinking, surely they'll just roll it out in their healthcare system, in the hospital. But then they looked at me and they said, no, Lamarck, we don't want to just deploy your app to every patient that leaves our hospital, but our pediatric groups. We want to deploy this patient to every pediatric patient that receives a diagnosis so they can access resources. But not only that, we want to deploy it through our specialty clinics. This is over 320 providers and thousands of patients a year that are getting the CareStarter app in their hands to facilitate and change continuity of care. And I can't tell you how excited I am. In fact, I might spontaneously combust right now on stage. What we know about this is that when we land children's hospitals and they believe in the product, that allows us to bring on the ecosystem. Educational resources, therapeutic resources, parental and family resources, recreational resources. If you're a kid in a wheelchair, what, you don't want to play sports? Think about that for a minute. These are amazing people with an existing condition, and they deserve to have opportunity. And I believe in ability. We do have competition in the space, and I think what's interesting about these guys is that they're doing pieces of what we're doing, and what's even more interesting is that we understand this, we believe better than these companies, and we're on the opposite side of the ball on diagnosis. I have an amazing rock star team. Brian and I have 5 startups between us with 4 different exits, and our team is the reason that we're a year ahead of our projections. I want to thank every single mentor in this room and the ones that I've met at Tech Ranch in Austin and all those that have helped us be successful and understand that we can truly change healthcare. We also have another announcement, which is we believe in this thought leader campaign, that patient care is important, it's highly personable, and we have been invited to TEDx on December 6th to speak about just that. CareStarter is the right team with the right product, alone in our space, ready to accelerate. In fact, I would say we are accelerating, and we believe that we can truly make a difference in patients' lives, in families' lives. And I want to thank you for your time today. Thank you very much.